Good morning, everyone. This beautiful Monday morning, in case you don't know me, I'm Dr. Mitra, your ophthalmologist in Northern California with two locations, one in Grass Valley and one in Roseville. Today, I'm in my Grass Valley location where I have clinic. I might be seeing you here. My practice is Capital I Medical Group, where we help patients gain their best potential vision so that they can live life fully and enjoy their hobbies for years to come. So today, this is going to be a quick one. I think my previous talks were getting a little bit long, so it'll be just, less than 5 minutes probably. And just wanted to get on here and give you a little bit of information as far as diabetes is concerned and how it may affect your eyes. So again, I'm not your ophthalmologist, but take this conversation more as informational in order to kind of arm you with the proper information to ask the questions from your primary care and your eye care provider, whether it's your optometrist or ophthalmologist. So, why does your eye doctor care about your blood sugar? Diabetes, as you know, affects all different parts of the body, right? It gives you peripheral neuropathy, where your feet have numbness, tingling, even burning sensation. It can affect all the other blood vessels in your body, but it also affects your eyes. And essentially, it can affect the different layers of the eye. What are some of the symptoms that you might have if you are affected by diabetes? So you can have blurred vision, you can have floaters, you can have difficulty seeing colors, and it can go as far as blindness too if it's not treated. So how does it affect the eyes? Diabetes increases, obviously, if it's not controlled, your blood glucose can be increased. As your blood sugar goes up, if it's very high, it can actually go inside your natural lens of the eye, which helps focus the light beam on the retina. And as the blood sugar goes into the lens can bring, well, the body can bring fluid in with it. So water follows sugar, and the lens actually enlarges or expands. So your focal point where you were kind of focusing images on the retina, that changes. So that causes blurred vision. Now, as your blood sugar goes down, within a couple of days, usually that fluid and glucose comes out of the lens and your vision goes back to normal. But there are possibilities where if the blood glucose has been high for a long period of time, it can damage the blood vessels all over the body, but of course in the retina too. And what it can do, as it damages the blood vessels, it makes the inside of that blood vessel leaky, the vessel itself. And so fluid, plasma, material can leak out, and it can cause some scarring, it can cause thickening in the back of the eye, it can decrease blood flow to the optic nerve, it can cause the macula, or the part that's responsible for your fine detailed color vision. It can cause edema or swelling in that area. So you're going to have trouble distinguishing colors. You're going to have trouble focusing on things. And of course, if it damages the blood vessels enough, if you have enough retinopathy or changes in the retina, you can actually get these little blood vessels, these proliferative or delicate blood vessels that grow around the optic nerve or anywhere in the back of the eye. And these blood vessels are highly susceptible to breaking and bleeding. They're very, very thin, very susceptible to breaking and bleeding. And so you can get hemorrhages. You can get, that's when you get the, floaters or even dark shadows. You can get a retinal detachment and go blind if this is not taken care of. So basically, what can you do if you know that you have diabetes? Few things that you should know when you come to the eye doctor. Number one, know your hemoglobin A1C. That's a blood test that your primary care more than likely does for you, where it gives us an idea of how well your control may have been over the past couple of months. If you have a continuous monitoring system, it's good for us to know time where percentage of time where you have been controlled. So The greater the percentage of time where your blood sugar has been controlled, less possibility or less chance of diabetic changes in the retina. So that's good information. What medicines are you taking? Are you insulin dependent? Are you taking other medicines? Have they had to change your medication, or is it pretty reasonably controlled? Those are very important. So then at the same time, your primary care will more than likely have you see an ophthalmologist or an optometrist at least once a year. So your retina needs to be examined at least once a year for us to make sure what degree. Do you have background changes? Do you have mild changes? Do you have the new blood vessels, or are these proliferative diabetic retinopathy or non-proliferative? Big words, but basically, do you have blood vessels or you don't have those new blood vessels due to diabetes? So the degree of diabetic changes determines how often you're going to see your ophthalmologist. So the more advanced it is, you might even have to be seen instead of once a year, you may have to be seen every 3 months or every 6 months, or somewhere in between there. But of course, if you have those changes, sometimes you may have to have treatment with injections into the eye to help with the swelling or new blood vessels. You may have to have laser all the way around the outside of the retina. This is laser that essentially focuses on the inside, to the periphery of the retina, and that will help regress those new blood vessels or cause them to go back to where they were. So many things for you to consider and ask for when you have diabetes. Make sure that you're controlling your blood sugar. Sometimes you don't have any pain or discomfort, or don't know that anything is wrong until you've already had these changes in the back of the eye. So thank you for watching today. Like I said, it was going to be a quick one. Make sure that you advocate for yourself. Make sure that if you're in the Northern California area and you want to see me, go ahead and go on my website, www.capeyemed.com, CAPEYEMED.com, and we'll be happy to take care of you. I will see you next week, Monday, 8 a.m. sharp.